Honestly, I would say this sounds a little dark, but stay with me, is the rising costs of healthcare and the increasing difficulty of accessing healthcare. And I really truly believe that if we weren't having these horrific increases in price and horrific decreases in access, that we would just float along with mediocre care and, mediocre, skimming from the top and essentially taking advantage of vulnerable populations. And so when I think about where we're going, when I think about leaving a night shift at, 8 in the morning and seeing, someone who doesn't have anywhere to sleep, sitting next to someone holding a Louis Vuitton bag with a Mercedes, fob. And then seeing those same individuals, both of them, when I come in for the next night shift 12 hours later, horrific things like that are happening, I think have the potential to change everything. And that's what I think we need, right? I think we need a system that is not just failing the most vulnerable in our population. We need a system that is failing everyone so that people stand up and they say, we can't look away anymore. We can't just say, well, the hospital in my neighborhood is functioning just fine. Like we really are nearing the point where I think your average person who maybe, wouldn't have time to notice otherwise is really noticing and is saying, maybe I will look at a direct pay surgery center and explore this. Maybe I will consider if a health share is right for me and my family. And I think those are things that 15 years ago we wouldn't have been willing to even look at. I know I wouldn't have.